Thank you very much for the opportunity to present. Good afternoon, dear attendings, dear residents, dear colleagues. My name is George Kudounas. I'm going to start my vascular surgery residency in Greece in the next month, and in the next few minutes, I will present you a case of our department regarding a COVID-19 patient with a horseshoe kidney who suffered ruptured AAA. Nothing to disclose. To begin with, this case was about a 59-year-old male patient with a past medical history of a known renal impairment with polycystic kidneys. Well, this patient was on vacation when he got sick from COVID-19, and at the same time, he suffered abdominal and back pain. The year visit to a peripheral hospital revealed a ruptured AAA, and he was transferred to our university hospital 18 hours after the rupture. This huge delay was mainly due to the absence of an appropriate ambulance crew and an ambulance for COVID patients. Eventually, on arrival to our department, this was a ruptured AAA measuring 60 millimeters in its diameter. Interestingly, the patient remained hemodynamically stable with a high blood pressure, 190 to 100, despite our instructions for permissive hypotension during the transfer. On arrival, we started immediately IV nitrates to lower the blood pressure, and the patient was taken directly to the OR. Well, the preoperative X-ray and the CAT scan confirmed the respiratory infection. Furthermore, the CAT scan showed the rupture and a horseshoe kidney. You see here the small arteries that arrive from the infrarenal aorta and go to the horseshoe kidney. Furthermore, the CAT scan showed these two normal renal arteries. Well, you see here also a large renal cyst and a large retroperitoneal hematoma pushing the left side of the horseshoe kidney anteriorly. The patient was suitable for a standard TEVAR, and the operation was performed entirely under local anesthesia with 2 small cut downs. These are the dimensions of the ruptured AAA. We used an endovascular stent graft with no suprarenal fixation. We inserted the main body from the right side and the contralateral limb from the left side. You see here the lab results in the postoperative period. Actually, there was an increase in the creatinine levels, and this was justified from the renal impairment, the contrast infusion, the COVID-19 infection, as well as from the isthmus ischemia. You know, I'm saying because it was a horseshoe kidney, we assumed that we may have sacrificed some of the polar arteries. This increase was managed with supportive treatment, you know, fluid administration, and with the appropriate nephrologist care. Indeed, 7 days postoperatively, the patient complained about pain in the abdomen. A low-volume contrast CAT scan showed no bleeding, no endoleak, no increase in hematoma. The only issue was the ischemia of the isthmus area, and we assumed that this was the cause of the pain. The same thing was more obvious 15 days later. You see here again, no endoleak, no bleeding. The hematoma was decreased, but the ischemia was present. The patient was discharged to home the 8th postoperative day. 1 month later, you see here that the renal arteries remained patent with no endoleak, and the hematoma was absorbed. The patient did not have any symptom 1 month later. The patient came back in less than 2 years for the scheduled follow-up. He refused contrast, so we made a CAT scan without contrast. Obviously, we cannot tell if there is an endoleak with no contrast, but the aneurysm was decreased to 4.33 centimeters, and the patient remains well 2 years down the line. To sum up, the isthmus arteries of the horseshoe kidney do not have a consistent anatomy and are usually variable. And I think that from this presentation, we should remember 3 key points. Number 1, ruptured AAA with horseshoe kidney is difficult for open surgical repair. Number 2, the original 2 renal arteries remained patent with adequate renal perfusion. And interestingly, the EVAR procedure did not exacerbate the renal function despite the initial patient's renal impairment. And number 3, renal arteries of the isthmus area in a AAA or even in a ruptured AAA may need to be sacrificed. I hope that increased your interest. Thank you very much for your attention. This is the White Tower of Thessaloniki in Greece.